Henry Ford Pediatrics, the office location at Cascade Ridge, Dr. Tulasi, Karri. Welcome to the show.
Thank you so much.
Happy Thanksgiving.
Thank you, same to you.
You have Thanksgiving off,
Yes.
but then you have to work the day after Thanksgiving.
Yes, definitely, because kids are sick, as you know, so they definitely need our services.
There probably will be one or two that ate too much.
Yeah.
Well, right now, a lot of parents are worried about RSV, and we're seeing all over the country. It's
Yes.
filling hospitals. They're asking for more beds.
Yes.
What's the status of RSV among children in Jackson right now?
Yeah, so definitely in the last few weeks we have seen a big surge in the RSV cases in all the settings, whether it be like the outpatient setting, in the hospital setting, or emergency rooms. And normally the surge for the RSV season, we see it around the late December, but this year has been different. We are seeing it from the mid-October. And when we see like the cases, like the positivity rate, it's the CDC, which is the Center for Disease Control, it reports that it's around 25%, which means like if we test 4 kids, out of the 4, every single kid is testing positive. 1 out of 4 is testing positive.
Oh my gosh.
Yes, that's a high rate.
So parents are wondering, well, is it the cold? Is it the flu? Is it RSV? How does RSV differ from cold or flu?
Yeah, actually that's a very important thing for the parents to know, because RSV, as you know, it's a viral infection, and when it starts like a simple cold, like the kids will present with sneezing, runny nose, mild fevers and stuff. But the thing with the RSV infection is it can actually get worse, and it can involve the lower respiratory tract. In kids, we see a condition what we call as bronchiolitis, which means the very small airways get involved. So that's when they have severe symptoms like getting short of breath, difficulty in breathing, turning blue. So that's why this infection is like, we should be very, very careful and cautious and watch out for these symptoms.
Especially for kids that under 2 that can't even describe what's
going on, right? Exactly. So parents are our best judges. So especially for the infants who are less than 1 year old, and if they see that they're not eating well, or if they're really irritable, and sometimes as they have episodes of pausing in the breaths, we call it as apnea, which is very common in less than 1 year, and it's like a feature of the RSV infection.
really.
Yes. So we have to make sure, like this apnea is a condition wherein they stop the breathing for more than 20 seconds.
Oh my gosh.
Oh, that's scary.
Yeah, so I remember when my kids were little and our grandkids, you go in and and you put your finger under their nose.
Yeah, the breathing or not, yeah, it's definitely scary. So we need to have a close eye. Yeah.
So at what point should they come in to see you, or ER or urgent care?
Yeah, so the things to look for. So as I mentioned, if they start with mild symptoms like simple runny nose, cold, fever, then it's okay, we can manage at home, and we'll talk about that as well later. But if they start developing the symptoms wherein they're like fast breathing and like sucking in the ribs here, or the nostrils are like flaring up and down, and for very young babies they move their head like this, like we call it as head bobbing.
Really?
Yes.
What are they doing? Are they trying
Like
to get
with breathing?
breathing?
Yeah, they'll try to do. So if you notice any of those symptoms, those are signs of respiratory distress. So definitely any kid with those symptoms should be seen in the emergency room. We should not wait. They should be immediately evaluated.
How long does RSV last in a kid?
Yeah, so the period of infectivity will be anywhere between 3 to 8 days, but it will get peak around day 3 to 5. So those days we should be very careful and keeping a close eye on the kid.
So it sounds like there's mild versions of it and more severe.
Severe, definitely.
And is there treatment when you have to hospitalize or see someone? What are things that you can do?
Sure. So when we see them in the outpatient setting, definitely we'll make sure like their breathing is comfortable and we check the oxygen levels mainly, and if they are normal within the range, then the parents can take care of them at home. So what we suggest is, this infection is associated with a lot of nasal secretions. So suctioning, nasal suctioning is like the main thing every parent should be doing.
The bulb.
Yes, the bulb. Because the younger kids, they breathe mainly through the nose, and if it's getting blocked with the nasal secretions, they will definitely experience that difficulty breathing. So main thing is that one, and the other thing for comforting, and if they have like mild fever or fussiness, definitely we can go ahead and do the medications like Tylenol, and if older than 6 months, definitely they can try the Motrin and Tylenol as well. And lots of fluids, that's the main thing, because RSV infection can be associated with dehydration. They are working so much, trying to breathe harder, so they'll lose a lot of fluids from the body. So we need to prevent the dehydration. So I always tell parents, push the fluids, small sips here and there. That's the best thing. I know they won't eat. Parents will be worried, oh, my child is not eating. I'm like, that's okay. First, our aim is to prevent dehydration. Push the fluids, even if they don't eat, that's fine. Yeah.
So if you have more than one kid in the house, what's the likelihood that, you said 1 in 4?
That's like the positivity rate.
Okay.
Yeah.
So how do you keep the rest of the family, and what about the parents? Is it just kids, or can?
Oh no, actually it can affect the adults as well. Actually, the two extremes, the young kids and the older adults who are more than 60 years, they are vulnerable again. And even like the adults who are immunocompromised or who are receiving some like chemotherapy drugs and who has chronic lung disease and heart disease, they can also get the infection very easily.
So I think during COVID we learned how to protect others. Same kinds of precautions in the house?
Yeah, so definitely this RSV infection is spread through droplets, like through the sneeze and through the cough. So the things we can do to prevent the spread is, the child who has the infection should be like covering their sneezing, covering the cough, and using a tissues and immediately disposing of the tissues. That's the main thing. And the other thing is social distancing. We saw it during the COVID period, like once everyone starts wearing mask and social distancing, there were no cases of RSV at that time. So that's the main thing. And hand washing, because the virus stays on our hand surface for up to 30 minutes. And then if we touch our nose or our mouth, it spreads. So strict hand washing with soap and water for at least 30 seconds, I would recommend.
All the same things that we did to keep
for
ourselves.
COVID.
Yeah.
Yes, exactly.
So you've got, it's going to be tough, like Thanksgiving or Christmas to have a sick kid. Just keep them in their little space, set up a little with drinks, and keep just
yeah, definitely. I know it's super tough with the young kids and stuff, and especially parents need to like take care of the sick kids as well. So whatever I suggest is, after you take care of the sick kid, try to like do all this hand washing techniques. And also the other thing is, like the frequently touched surfaces like the doorknobs and stuff, try to clean them, wipe them off.
Okay. So we don't have to go back to washing our boxes of Triscuits, but it's similar precautions. So it's a virus, because that's in the name. Respiratory
syncytial virus.
So, but there's no vaccine.
Yeah, so research is on the way. There are many studies going on to develop the vaccine, but at this time we don't have any. But there is actually a medication called the palivizumab, which is a monoclonal antibody. It will help to prevent the episodes of the RSV. So that medication will give it to the susceptible individuals, like very preterm babies who are born earlier and who have like some lung issues and stuff. So if there is any child with chronic issues, it's always better to talk to their pediatrician to see if the child qualifies to get that medication.
And with anything, if you're concerned about your child's health and they're in distress, just go to the ER.
Yes, the parents are the best judges. They know once they see the signs of respiratory stress, it's always better to be getting them assessed in the emergency room.
Great.
Yes.
Appreciate your expertise and your time. Thank you.
Yeah, thank you so much.
And happy Thanksgiving.
You too, thank you.
Dr. Tulasi Karri, pediatrician with Henry Ford Pediatrics at Cascades Ridge.